Okay, great. So, hi everyone. It's Mutima Jackson Anderson. I'm with the Ruby A. Neeson Diabetes Awareness Foundation. I am very excited. June is not only Men's Health Awareness Month, it's also Pride Awareness. So, I have been really searching for someone that I can speak with that's making a difference in the LGBTQ plus community. So, thank you to Christopher Weaver, our PR consulting, for setting up this interview. So before I get started, I just want to introduce our guest. I'm going to let Kevin go first. If you can introduce yourself, and then we'll get started.
Okay. So hello, I'm Kevin Mines. My social media presence is Kyng Kevyn. I'm an author, a content creator, and I've had about, I want to say, 8 years of experience in HIV research. So I'm not necessarily that far detached from the medical field and helping people in our community.
Great. Okay, and you two great gentlemen.
I am Ta'Shobe and Kindred-Williams. This is my husband, Preston. And I am the co-founder of Kingfinity and co-creator of Columbus Melanin Pride.
Okay, I love Kingfinity. I just like saying that, Kingfinity. Okay, so we know that June is Pride Awareness Month. And for those that don't know, can any of you kind of give us the background on why Pride is so important, the significance of Pride?
Kingfinity, I want to take that because y'all, Columbus Melanin Pride is sort of your thing. So
Absolutely. So when it comes to Pride, back in 1969, Marsha P. Johnson and a group of trans women felt as though they were not receiving, fair and equal rights. And so they began to riot. A lot of people don't know that Pride started with a riot in 1969 at Stonewall. And so over the years, different cities has taken that on and celebrated, because they've really helped to birth the Renaissance movement for the gay rights movement. And so Pride is important because we're still fighting.
Yes.
We are still fighting to be seen. We're still fighting to be heard and to feel supported. And so those of us that are living in our truth, we try to create some kind of a support system to push people forward, to feel proud in their truth, wherever that may be and whatever that may look like.
Oh, wonderful. And when you say riot, when I think of riot, it started from a riot. I think of a revolution, and that brings about change. So although I do see that great change has happened, I do know that we have a long way to go. So anyone else would like to offer any feedback or any comments about the significance of this month?
So I will tag in. One, thank you, Preston, for the history of that, because like you said, a lot of people aren't aware of that. But for me personally, it is a celebration of self. It's the opportunity to learn to love and appreciate myself. And I do this amongst other people who have learned to accept themselves, or who have gained the courage to be open and truthful with themselves in their communities. And it's a celebration of love. I recently said that throughout Pride Month, all of the events that happen, you see that it's full of people who just love. We don't want war. We don't want division. We just want to love ourselves and the people in our lives. And that's why it's significant to me.
I agree. I have, you probably can't see my shirt. My shirt says, love unites us. And I agree. I'm really over the division, over the discord. So I think these conversations are very important. Mm-hmm. I may not identify as a lesbian or gay woman, but I do have, my brother is gay. I do have gay friends, family members, and associates, business partners. And I really don't even think about it like they're just people to me, and who they love. So I agree. I'm really over the division, and kudos to those who are living in their truth. And hopefully for those who are not, hopefully Pride could be a time where they, they don't have to hide, or they can be open. And as Kevin said, live in their truth. So thank you. So with regards to diabetes, because I'm a diabetes advocate, diabetes affects 30 million Americans. And there are a large number of people that have diabetes that don't know they have diabetes. So diabetes affects different segments of the population, including in the LGBTQ plus community. I want to get it right. So what are some of the health disparities? Because when I'm out in the community, a lot of times there's one chronic disease that's associated with the community, and that's HIV and AIDS. Although it's very serious chronic disease, it's not the only chronic disease that affects the LGBTQ plus community. So, and diabetes is very prevalent. And I also did some research. I may be reading some things. I also did some research, and it does suggest that certain subgroups within the community are at greater risk of type 2 diabetes. And type 2, unlike type 1, is lifestyle influence. So I wanted to just kind of get your opinions on that. Why do you think that's the case? Because type 2 is mostly associated with lifestyle. And I think personally it could be because maybe stress of not being in their truth can affect that. So, and diabetes is very prevalent. So I just wanted to have some conversations. Do you know someone with diabetes? I know when I first started our support groups, we rather have a support group for ourselves. So we're talking about being including everyone. Why do you think that, that's the case, that, that they don't want, that you may not want to get support from someone who may not be, in your community? Does that?
Yeah.
Well, I can, I think with one, there's already the trying to mentally deal with having the diagnosis of, HIV with someone that is HIV positive. And then when you stack on something else like diabetes, that is another thing to add on top of it. So that, and a lot of times there are some people that will say, okay, I'm going to deal with this one and this one, I'll be okay. So they'll stay on top of their HIV meds, but then they'll eat, they won't eat right. So then that makes them, as far as health-wise, make them their diabetes become worse. So that's one thing, just something to add on to what they're already dealing with.
Yeah.
It can also be like a mental thing.
Yeah, which is a lot, because even for those that have been diagnosed with HIV, some of the medication can cause type 2 diabetes because it can affect your glucose. So I think this conversation really is important because for me, managing your diabetes is very, very important because I want everyone to live long and healthy and happy. So in order to do that, we have to have, again, these conversations. So how can we kind of bridge the gap? And Kevin, did you want to say something?
Well, I was thinking about the statistics of like the amount of people within this community who do end up being diagnosed with diabetes. And like considering that it is a lifestyle situation, just thinking about things that could influence that type of a lifestyle. So today days are different, things are different these days where we're a lot more open, out and proud. We live independently, we live confidently. We're not afraid of, living in our truths. Whereas 10, 20 years ago, you couldn't do that as openly. And I could imagine like the certain lifestyles that would lead people to stay up all night because that's when they felt most safe or felt most accepted. And maybe their sleep patterns were off and their eating patterns was off. And I mean, back in the 80s and 70s, we know it was about dancing, going to the clubs and everything like that. So again, those things are lifestyle things. How do we bridge the gap? I think the message is kind of universal with all types of healthcare. So finding their primary doctor, staying on top of your health, eating healthy, exercising. But we all hear that already. So I think that we should probably change those conversations just slightly so that we can reach the people who are in this community that are not only living with it, but are at risk of being diagnosed with diabetes.
Yeah, and you said something important, like we already know we should eat healthy. We already know we should exercise. But I think a large part of a person with specifically with type 2, their success is based on their support. So it's so important to have support, to be in a really safe environment So again, it goes back to what we said earlier, Kevin, of living in your truth, because that's really a great way to really have, you're only able to get the support when you are, open and being honest. So you also mentioned something I thought was really interesting. I was having a conversation with my husband and some friends about the 80s and dancing. So like one of our favorite genres of music is house music. So because it is Pride Month, I always mention the origins of house music is, because some people don't know that it is a gay Black man. He actually is the godfather of house music. So I just wanted to kind of throw that out there. Did you want to say anything, Kingfinity?
So I think one of the big disconnects, just not even just with diabetes, my line of work is dealing with people who do have HIV.
Okay.
And one of our big disconnects is trying to get them access to care. So dental, checking in on their diabetes, checking in on other health issues that could be caused by the HIV. And what we find is that, like Ta'Shobe said earlier, there's so much that they're dealing with just the HIV diagnosis that mental health isn't really considered. Diabetes isn't really considered. Dental isn't really considered. They're just looking at the fact, hey, I'm still alive. I'm going to take my medicine and, let it be that and roll with the punches. And what we find ourselves having to do is to help them to find access. I think that's the big key with any health disparity is access, and the people that are providing that access, helping them to feel seen. So you kind of mentioned that earlier, wanting to be helped by people that look like them because they're able to trust them. A lot of people in the Black community do not trust anyone in the health field. I know I was raised and my dad would not go to the hospital. He did not like going to the hospital. There's such a distrust, especially those that have roots in the South. And so there's so many layers. There are so many layers. And, even if we strip the LGBT away, it's still Black people. At the end of the day, they are still Black people with a lack of access. We can tell them all day, every day to eat healthy. And, they go to the corner store where it's accessible and it's canned fruit with a high fructose corn syrup. And it's just like, well, I'm eating fruit.
And it's not right, because there are so many neighborhoods. I'm in Atlanta. There's so many neighborhoods, and I was born and raised in Atlanta, Georgia, but there's still so many neighborhoods that are food deserts, that don't have healthy fruits and vegetables, that don't have sidewalks for people to walk. So don't have parks. There's maybe safety issues. So you're absolutely right. And me working as a community health worker, my job is to connect people to resources, but there are barriers, especially in our community. Of course, trust is one. We don't trust the doctors because history, kind of says why we have that issue, but also religion. Sometimes you go to your pastor and they'll say, well, you gotta, pray it away, just pray it away. And if you're sick, then you're not godly enough. You don't have God in you. I've heard some of that. So how can we be more? And another thing you mentioned with the healthcare providers, I just don't think there's culturally sensitive material for the LGBTQ community. Not even that, but as you mentioned, for the African-American community, the material is just not culturally sensitive. And the two things with diabetes is go eat healthy and exercise, and that's it. But that's not it. Diabetes, you can't have a cookie cutter approach to healthcare, especially diabetes, because everyone is different. Our environment's different. Some people may have kidney issues. Some people may have HIV. Some people may have weight issues. So, we have to address it from a more innovative, individual, approach.
Absolutely. And then the other thing to consider with that is money.
Yes.
We can
right.
tell somebody, I grew up in the DC, Maryland, Virginia area.
Okay.
And, we have the Whole Foods all over the place. We have the different grocery stores. And then you go in and it costs more to get a salad and to do meal prep in the grocery store than it is to get a Big Mac from McDonald's.
Yeah.
And it's like, well, they want me to eat healthy. I may have access to a grocery store, but I can't afford that lifestyle.
That's right. Yeah.
And if I can, just drive through and get a burger and not have to spend time trying to cook a meal, and I'm trying to get my kids from daycare before I go to my second job. There's just so many differences here. It's not a cookie cutter approach to health. It doesn't matter if you strip away the Black part or you strip away the gay part. It's all about access.
That's right.
It's all about access.
That's right. And for those that will be watching later, you just mentioned something, you said something that was very important. Economics plays a huge role to your healthcare. There have been, if you're sick and no money, your chances are you being well is kind of slim. I'm not saying wealthy people don't get sick, but it's not as much as the disparity is not there. Kevin, were you about to say something? Kevin?
Well, just to tag on to what you were just saying, a lot of the times, and I'm sorry, I lost my thought. That's why I was just sitting there. Sorry. But it was based on the economics, that you said, not that the wealthy don't get sick, but it's like they have access to things to keep them healthy. And if they do get sick, they have the economics to take care of themselves. Another reason a lot of people don't go to the hospital or get checkups is because they don't have insurance, or they have bad insurance or whatever like that. So it's like, we're more prone to get into some types of sicknesses, and we're not able to take care of the insurance bills or hospital bills. I know people who are pretty much bleeding out, and like, I'd rather just bleed out than to go to the emergency room.
Yeah.
Unfortunately.
And that's even with people who make decent money.
Yeah.
They're like, I'm not paying $500. And then you can't pay it, and it gets sent to collections, and
the cycle continues. It's just a vicious cycle.
It always continues.
Wow. Well, this is really, and I said I didn't want to keep you long because I could really probably speak with you all day, but I did want to be respectful and honor this time. And as I said, we have, come a long way. There's still more, we still have to come further. So any final thoughts? And I want to know a little bit more about your organization and your amazing show, Kevin. So how can I support you, or what would you like our audience to know, and some of the difference, again, that you are making in the LGBTQ plus community?
So the name of my show is called The Cocktail Hour with Kyng Kevyn. And on the show, I've highlighted artists, doctors, filmmakers, and that's just the beginning. This is my first season. We legitimately ended our first season last night. It was the season finale.
Really?
But the idea is, the world is a very scary, dark place sometimes, and we just need a break, so I want to sit down with not a recording artist, not an actor, but a friend, have a drink and have a conversation, and hoping that my audience will see that and they'll get a break from the craziness. They'll just feel like they're sitting at their favorite bar with their favorite friends.
Well, I've seen your show. I'm a fan of your show. I didn't know it was you would just had only been on for a year, so I know more great things are to come. Definitely. I tuned in when Christopher was a guest on my cocktail, and I will continue to watch. So thank you so much. And I just want to thank you for the difference that you're making. It takes a lot to step up to affect change. So thank you. Thank you. So I want to know more about, because I go to Ohio occasionally. My husband is from Cleveland. So, and I have friends in Columbus. So I want to know more about your great organization. I see you have a fantastic Instagram page. You're doing a lot. So I want to know more about your organization.
Absolutely. So it's kind of two-pronged. We started a clothing brand September 1st of 2019.
So that's where Kingfinity came from.
Yes.
Okay.
And we started the clothing brand Kingfinity. We had a launch for the brand, and we said we wanted to amplify Black businesses. So we had a blackout lounge full of Black business owners and things of that nature. And you walked in and it felt like you were walking into Wakanda. It was just an amazing experience. And people kept saying, when are you doing the next one? When are you doing the next one? And so we began planning for our next one, and then COVID hit. And so we started trying to do different things to keep our following strong. And then the social justice happened. And so I said to my husband, I said, babe, I think we should do a march. And we organized a march. There were 3,000 plus people in the middle of a pandemic, marching peacefully and safely in Columbus.
With our masks on.
And that really put us on the map a little bit. And it kind of forced us to say we're not just a clothing brand anymore. We've become actual community organizers. And so in a sense, we're kind of like Marsha P. Johnson, like our pride started with a march. It started with a riot.
Wow, I'm so sorry. Wow, that's amazing. Go ahead.
Yeah, and so I had someone to make that analogy, and it kind of blew my mind. And then the following year, the world was opening. It wasn't open, but we needed some kind of pride within our Black community and our brown community, and so we created Columbus Melanin Pride. And we wanted that to be something that was all inclusive. And so we did that, had a great turnout. And then we said, okay, we got to do it again. This can't just be a one-time thing. And we had Kevin, join us last year, and we have him joining us again this year. He's actually our champion of Pride. And so it's blossoming into something a lot bigger than we ever thought it would be. But the amount of people that are moved by it is just amazing to us.
And I'd like to jump in on that. Last year when I was invited, I had the time of my life. I'm really looking forward to coming back this time. What I love about what Kingfinity is doing is they're reaching out, and they started this as Columbus Melanin Pride, but I think with the way they've been reaching out, they're reaching further than just Ohio at this point. People from different parts of the country are looking at what's going on here at CMP. And I'm really excited to see, because it's not just the, hey, let's party, this educational piece, there's a health piece, there's the community involvement and engagement piece and education. So this is an amazing thing that I'm excited to be a part of.
I feel so blown away that I'm speaking to you all. That's absolutely amazing, because all of you are affecting social change. And with the Black business, because that contributes to the health and wellness of the community. Yes. Taking a break with your podcast, because the world could be, feel like the weight of the world on our shoulders sometimes. So we need that break. Your podcast is so important as well. So, and the fact that you are working together and supporting each other, I think that's a beautiful thing. Hopefully you could come to Atlanta, come to Atlanta next. So, and I love the work that you're very, very, well-versed, and you have be very knowledgeable even at the healthcare arena. So I know that it's all a comprehensive work that you're doing. So I really honor, my hats off to you, or much esteem to you all for the work that you do. And I'm so happy I was able to talk to you. So the last thing I do want to know, for those that, I was listening to one of my favorite songs by Stevie Wonder, Love's in Need of Love. There's so much hate going on. And I know not everyone is accepting. So how can we, because I'm always talking about how can we all come together? I know there's people out there that's going to spew hate, but any thoughts on how we can really come together? Because we're one.
Yeah. I think firstly, if we were to connect with our own humanity.
Yes.
I think it starts with that, like definitely leading with love. But if we can connect to the fact that you're my brother or you're my sister, I don't care your sexual identity, I don't care your sexual orientation, I don't care your skin color. None of those things matter, because at the end of the day, you have a heart that beats like I have a heart that beats. So if I can connect to my humanity, our differences don't matter anymore, because that's the one thing that we all have in common.
That's right. That's right. That's perfect. Perfect final thought.
I have nothing to say.
Right.
Happy to add to that.
I'll be pleased. Please follow these guys on their social media. Make sure you like your podcast, Kevin's podcast. It's amazing, and make sure you get hit the notification bell so you can be alerted when he puts out new videos. So I'm sorry, new content, new interviews. But I am so happy I was able to, I had this time to speak with you. And I know we are celebrating Pride this month, but your work continues all year long. Yes. So thank you for the great work that you do. If I could ever be of support, I will. And if I can ever help with anything, I will. So thank you so much. And everyone, make sure that you take care of your health. We covered a lot here. So I'll make sure I put their Instagram links and how you can get in touch with them. So thank you so much. Thank you so much
for having us.
I'm gonna stop the video now.